Teratogenicity, or the ability of a drug to cause birth defects, is one of the most serious and sensitive matters when it comes to the use of drugs. These effects may lead to fetal death or are often permanent with no cure during the duration of the baby's life. In this video, we will talk a little bit about drug-induced teratogenicity and what drugs may cause birth defects. The information presented in this video should not be used for diagnosing or treating a health problem. Consult your healthcare provider before making any changes to your health plan. Remember to subscribe to this channel so you can be notified of more pharmacy and medicine-related videos. A teratogen is a substance that causes congenital disorders, both cognitive and physical, in a developing embryo or fetus. A teratogen is anything a person is exposed to or ingests during pregnancy that's known to cause fetal abnormalities. Drugs, medicine, chemicals, certain infections, and toxic substances are examples of teratogens. Teratogens can also increase the risk for miscarriage, preterm labor, or stillbirth. Teratogenicity is the capacity of a drug or substance to cause fetal abnormalities when administered to the pregnant mother. It is important to note that the following factors determine how dangerous teratogen exposure is during pregnancy: the drug itself, or the substance or type of toxin, how long the pregnant person was exposed, the amount of the exposure in terms of dosage or quantity, the gestational age of the fetus in terms of what weeks of pregnancy they were at the time of exposure, and hereditary factors that could increase the risk. Fetal exposure to teratogens accounts for about 4 to 5% of congenital disorders. Exposure to teratogens is harmful no matter what point you are in pregnancy. However, the risk is slightly higher during the first 8 weeks. This is because many organs and systems are still developing, making the fetus more sensitive to the harmful effects of teratogens. Studies show that teratogens can impact the fetus as early as 2 weeks from conception. Neural tube defects can occur before 5 weeks of pregnancy is completed. The neural tube forms in the brain and the spine. Neural tube defects occur when the neural tube doesn't close properly. Therefore, it can lead to several congenital disorders. Let's talk about some of the mechanisms of teratogenicity. Based on a cumulative literature review, the following was identified in one study. There were 6 main reasons that were identified for the mechanisms of teratogenicity, as listed here. The first is folate antagonism. Folate is converted through 2 reduction reactions by dihydrofolate reductase to the naturally bioactive form, tetrahydrofolate, which is converted into 5-methyltetrahydrofolate monoglutamate. 5-MTHF is the main form of folate in the blood circulation and is transported into cells by 3 routes: by membrane-associated receptors, by a carrier-mediated system, the reduced folate carrier, and by passive diffusion. Inside the cell, it acts as an essential coenzyme in many biochemical reactions by being an acceptor or donor of 1-carbon units in, for example, purine and pyrimidine synthesis and DNA methylation reactions. Since rapidly proliferating tissues require DNA synthesis the most, it is obvious that folate-dependent reactions are essential for fetal growth and development, and that folate requirements increase during pregnancy. In addition, DNA methylation is known to be involved in the epigenetic control of gene expression during development. The next point is neural crest cell disruption. During neurulation, the neural crest cells detach from the neural folds and migrate into the embryo to give rise to numerous structures. In the craniofacial region, various cell types and structures, including intramembranous bone, cartilage, nerves, and muscles, are derived from the cranial neural crest. So if there's a disorder in this formation, this will lead to some teratogenetic effects. Next, endocrine disruption. Endocrine disrupting chemicals, or EDCs, may interfere with the physiologic functions of endogenous hormones by affecting their release, binding, or metabolism. Their actions may not only depend upon their affinity or specificity for the estrogen and or androgen receptors, but also upon their ability to activate or inhibit receptor-mediated actions, which are dependent upon the absorption, distribution, metabolism, and excretion of these molecules as well. The action of EDCs in utero have been of concern because of their possible impact on the developing reproductive systems. Next, oxidative stress. In redox cycling reactions which involve oxygen reactive oxygen species, or ROS, such as hydrogen oxide, alkyl peroxides, and various radicals, like hydroxyl or superoxide, are generated. The creation of ROS is induced by internal and external agents such as phagocytes, enzymes like cytochrome P450 monooxygenase, irradiation, and exogenous chemicals, or external chemicals. Endogenous ROS serve as a second messenger in signal transduction and are thought to be important in ion transport, immunological host defense, transcription, and apoptosis of unwanted cells. However, ROS can be harmful by binding covalently or irreversibly to cellular macromolecules. Oxidative stress, an imbalance between ROS generation and antioxidant defense mechanisms of a cell or tissue, causes irreversible oxidation of DNA, proteins, and lipids, leading to inactivation of many enzymes and cell death. In addition to damaging cellular macromolecules, oxidative stress may affect gene expression by interfering with the activity of redox-sensitive transcription factors and signal transduction by oxidizing thiols. During the prenatal period, this may result in birth defects and growth retardation, and in severe cases, in utero death. Vascular disruption. Vascular disruption defects are structural birth defects resulting from interference with or extrinsic breakdown of an originally normal prenatal development of the arteries, veins, and capillaries, or the vasculature in general. Prenatal exposure to agents which can induce vascular disruption, however, can also induce damage later in pregnancy to structures that were initially formed normally. After birth, it may be impossible to determine whether a certain structural anomaly, such as a limb defect, is the result of an intrinsically abnormal development process, vascular disturbances, or, for example, amniotic banding. Vascular disruption refers to disturbances in the blood circulation in the urine placental unit, the placental fetal unit, or the fetus itself. These disturbances include hyperperfusion, hypoperfusion, hypoxia, and obstruction. Lastly, specific receptor or enzyme-mediated teratogenesis. Many medical drugs act on a specific receptor or enzyme in the human body, leading to a particular mechanism of action and may contribute to the occurrence of teratogenicity due to this mechanism of action. For the purposes of brevity, we can't go into each one of these in detail, but the main receptors and enzymes that may affect teratogenicity if altered include angiotensin converting enzyme and angiotensin II receptors, hydroxymethylglutarate coenzyme A or HMG-CoA enzyme, reductase enzymes, histone deacetylase or HDAC, cyclooxygenase 1 or the COX-1, N-methyl D-aspartate or NMDA receptors, 5-hydroxytryptamine, also known as 5-HT or serotonin receptors or transporters, gamma aminobutyric acid or the GABA receptors, and carbonic anhydrase. Now that we've discussed some mechanisms of teratogenicity, what are the birth defects that teratogens can cause? Some examples, and this is not a cumulative list, include brain or spinal cord issues like anencephaly, physical or structural malformation like small bones or missing body parts, cleft lip palate, cognitive impairment or neurological issues, cardiovascular issues, or heart conditions. Here are some examples of teratogens. They include anti-epileptic drugs, antimicrobials, anticoagulants, which are blood thinners, antithyroid medications, vitamin A products or their derivatives, hormonal medications like androgens, estrogens, progestins, and also alcohol, tobacco, and other recreational drugs. Healthcare providers weigh the pros and cons of prescription drug use to determine what poses less risk to the pregnancy. For example, phenytoin is a medication used for seizures. It has a negative impact on the fetus, but may be medically necessary for the person who's pregnant to prevent them from entering a serious medical condition. The US FDA created 5 categories to classify the risks of medications during pregnancy and consisted of categories A, B, C, D, and X. While helpful, the category system oversimplified a very complicated subject. This category system was discontinued, and a newer system called the Pregnancy and Lactation Labeling Rule, or PLLR, took effect in 2015. It removes the previous letter categories above that I mentioned. The PLLR gives healthcare providers relative information for decision making when treating people who are pregnant or lactating. It considers many other factors and puts data in a better context for the providers. Alcohol, cigarettes, and recreational drugs are known teratogens. Alcohol affects the fetus's central nervous system. Drinking alcohol during pregnancy increases the fetus's risk for fetal alcohol syndrome, which is a disorder that can cause abnormal facial features, a small head and brain, and other physical and behavior disabilities. There's no amount of alcohol intake that's considered safe during pregnancy. Cigarette smoking is associated with fetal growth restriction, premature birth, and miscarriage. Smoking also affects the fetus's sensitive lung tissue and brain. Using substances such as cocaine, methamphetamines, heroin, and marijuana during pregnancy can cause low birth weight, heart problems, and neonatal abstinence syndrome. This is when a baby goes through drug withdrawal after birth. Sharing needles can also cause infection. About 5% of people use these substances during pregnancy. Certain over-the-counter and prescription medications are considered teratogens. Therefore, it is important to tell your healthcare provider about any medications you take. Read the labels before taking OTC medications or supplements. When in doubt about the safety of a substance, call your healthcare provider. It is best to avoid the substance until you hear from them. Lastly, some general advice. Talk to your healthcare provider about any medications you're taking. Avoid cigarettes, alcohol, and recreational drugs. Do not take any supplements, medications, or prescription drugs without checking with your healthcare provider. Avoid cleaning litter boxes due to the risk of toxoplasmosis exposure during cat feces, which has been linked to teratogenicity. Avoid hot tubs, saunas, and anything that raises your internal body temperature. Remove tuna, swordfish, and other fish that may be high in mercury from your diet. Talk with your supervisor or human resources about harmful chemicals in your workplace. Last but not least, it's important to have an open and honest conversation with your obstetrician during pregnancy. This includes being truthful about alcohol or drug use. They're there to make sure your pregnancy is safe and healthy. Don't be afraid to contact your provider before taking medicines or supplements. It's better to be overly cautious during pregnancy. I hope you found this video educational and useful. Please remember to like and share. Thank you.